the Spanish flu. So some similarities there. The same methods that we are using today are borrowed from that pandemic, which is the isolation of people, social distancing, masking. I don't think that they had the N95 mask at that time or N94, but the same principle applied. Isolation, use whatever you have to protect yourself and cover your face.
Thank you. Let's cross over to the South African Broadcasting Corporation and say good morning to Sophie Mokoena. Morning, Sophie. Please go ahead with your question.
Good morning, Dr. Nkenkesong. The President of South Africa yesterday indicated that South Africa is looking at lifting the state of disaster. And that simply means those restrictions that are currently in place are likely to be removed. And we saw the United Kingdom yesterday doing almost the same, even going as far as doing away or announcing that they will do away with those non-pharmaceutical interventions, such as wearing of masks. How do you feel? Do you think this is the right time to do that? Are we in the endemic situation, or are we still having a pandemic?
Oh, no, absolutely. We still have a pandemic, Sophie. Let there be no doubt on that. Let's clarify one thing, if I may. An endemic situation doesn't mean that we live with a high level prevalence of a disease or deaths. An endemic situation is where you have brought down the prevalence of the virus to a level that you can live with. And I don't believe that we have brought it down to a certain level that we can live with. Now, living with, meaning that we still have to do surveillance, have the treatments around, and continue to vaccinate them. And endemicity doesn't mean that it's not going to hurt you. I mean, remember that HIV, malaria are all endemic, and then they kill about 1 million people, the two of them, tuberculosis and malaria in Africa every year. So I think moving to an endemic thing doesn't necessarily mean a good thing. It only tells you that the virus is with us. In other words, to put it very bluntly, if we declare today that COVID is endemic in Africa, it means that is the level that I believe that we will live with, which is with a positivity rate, an average positivity rate of 11%, which is extremely high. So I think just to say that endemicity doesn't mean a good thing. It only means that the virus is there with us. But public health-wise, you only declare that when you've gone down to a certain level, that you can only sporadically find the virus, test it. We have to live with the fact that we may not completely eradicate this virus or control it, but we may bring it to a level that it will be like an outbreak. You hear that there's an outbreak in some parts of Johannesburg or Cape Town, then you massively mobilize resources to go there and tackle it. That is the scenario where it becomes endemic, like the seasonal flu, right? I mean, it comes in every season and then disappears and stuff like that. That would be a classic case of endemicity. Now, whether I've not looked at the information from South Africa, I don't know what is exactly they are lifted or plan to lift, but South Africa did a remarkable thing at the end of last year, where they look at the data and they said, well, we're getting more infections from Omicron, but we are not seeing a corresponding increase in number of deaths, and we are not seeing our hospitals overwhelmed. So we'll maintain, will not impose additional restrictions there, which I think is a big lesson to learn, a big public health lessons to learn, and it has inspired us to the extent that we look at that data also, and we were able to use that to inform a decision that this next summit of the head of states should be a face-to-face in Addis. If we do certain things, we impose that everybody who comes in there wear a mask, specifically the N95 mask, to ensure that we really diminish transmission. With that, people that comes with a delegation are vaccinated, and that we do routine testing every every day, then we mitigate that as much as possible. So we continue to learn how this virus behave and use science to inform decisions and make policies there. So I look forward to reading more about the South African, what is it specifically that South Africa plans to do, so that I can properly share my views on that.
All right, thank you. Time to say hello to Vinicius Assis, who's writing to us from Brazil. And Vinicius says, what is the big issue in terms of vaccines expiring? And why are there countries that are still not able to use it in time? Why are countries not able to use their vaccines on time?
The vaccine expiration, as I said earlier, is mainly related to the short expiration date that arrive. It doesn't mean the vaccines themselves have, when they leave the factory, they have a short expiration date. It only means that a vaccine that is shipped to country X had arrived the country of origin and probably stayed there for more than half of the shelf life, and then is shipped to a third-party country at a point where the expiration date was coming very, very close. So I think that is all that it means. Second thing about vaccine delivery, which must be the focus for 2022, is the logistics. The logistics of moving those vaccines from the airport, from the time they arrive to the mode to where we call the last mile. That is going to be the big fight this year for us to strengthen those systems, the delivery systems, the distribution systems, the engagement of the community. We have seen a remarkable uptake of vaccines in settings where we engage the community, like the religious leaders, and they simply need to go into the church service or the mosque and make an announcement and build that rapport with the community. Then after church services, you actually see an increase in uptake of vaccines. We also have to bring vaccines to the population and not only require that the population should go to where the vaccines are. In the scenario I just described, we saw that by just bringing a caravan that contains vaccines and positioning it outside of a church or mosque, increased uptake, because immediately people left that facility or their worshiping center, they moved into a vaccination center and were able to be immunized. So we have to be very creative in order to facilitate uptake of vaccines. We have to be innovative in the ways we behave. Of course, there will be standalone vaccination centers where people can move there and get vaccinated, but we should also have mobile vaccination centers where we can bring mobile trucks with vaccines and healthcare workers to certain populations.
Thank you very much, John. We have a nice message here coming from Lillian Luwaga. And Lillian says she's just writing to say Happy New Year to Dr. John and to me, and to thank us for these regular updates. So thank you very much, Lillian, for that really nice and encouraging message. I'm seeing that Sarah still has her hand up. Sarah, do you have a second question?
I do, thank you. So we've heard a lot about the concerns around expiry dates over recent months, but the percentage that you noted in your opening remarks seems to be very low. Can you put that percentage in context? Do you think that percentage is higher than the expiration percentage for other vaccination campaigns for non-COVID-19 vaccines? Are you concerned about that? That percentage, or do you think it's normal for vaccination campaigns? And to follow up on the last question in your last response, what is the specific expiration date on J&J vaccines compared to the other vaccines in terms of kind of when they all leave the manufacturing facility? Thank you.
The last question, let me start with that since it's very fresh in mind, is I will not be able to give you the exact expiration dates, but we take that next week, we'll discuss that and give you information by vaccines so that we have, we also learn from it. So that's the whole purpose of this forum, is to exchange ideas and share and learn from each other. So we'll take that up and the answer and bring it back to this forum next week. In terms of the 0.5%, there is, let me be very expire pains me, because that is a life that can potentially be saved. Absolutely no doubt about that. So I'm not even going to say that it is the 0.5 is like acceptable or no. I mean, there are 2.8 million vaccines there. If assuming there are 2 doses of vaccines, if they had been administered in the arm of an individual, would likely be saving 1.4 million lives, okay, or preventing the deaths of 1.4 million lives or the hospitalization of 1.4 million lives. I really just want to be that to be clear, go on the record that any expired vaccine is really is painful, and we should do everything possible, both from the donation side as well as the receiving side, to avoid that we create scenarios where vaccines will expire. I don't know if the 0.5%, how it compares to other vaccination programs. I don't have that information, unfortunately.
All right, thank you. Judith Akolo has come back, and she says she has a point of clarification. She says, kindly, Dr. Nkenga Song, is the Africa CDC therefore going to recommend that the African Heads of State Summit be a face-to-face meeting?
We do not recommend to head of states. We provide an advisory to, as a technical agency to the African Union. We are a specialized technical institution of the African Union. And they themselves last weekend took the position that they would have a face-to-face meeting based on the epidemiological situation that is saw on the continent, and based on the advisory that we gave them. If they were to have a face-to-face meeting, what would be required? So that decision has been taken at a much higher level, not Africa CDC necessarily recommended. So the meeting will be a face-to-face.
Thank you very much. We have the executive council, which will start on the 2nd to the 3rd, and then the assembly of heads of state and government will take place from the 5th to the 6th of February. And currently today we have the meeting of the Permanent Representatives Committee, which you can join through live streaming, and those details are on our different digital platforms. So thank you very much for that follow-up question regarding the statutory meetings of the African Union happening from today until the 6th of February. Let's move on now and say hello to Chinedu Asadu, who is with Associated Press.
When there's a noise, interference there, and I don't know if it's from your side or my side. I don't know. Maybe a technical staff can look into that.
Hear it? I'll try to speak. Just let me know if you still hear the noise.
Yeah, there's still an interference there, which is making it very uncomfortable. But I think we can hear you.
Okay, let me try to speak louder. We had a question that was coming in from Chinedu of Associated Press. And Chinedu says, with just about 62% of doses delivered to African countries having so far been administered, and full vaccination still low at 10.4%, where exactly does the challenge lie in vaccinating the African population? I hope you've been able to capture that question.
Yeah. I think let's make sure that we do not we put the numbers in context. So as I said, about 572 million doses of vaccine have been delivered, and of that amount, there's 60-something% that are administered. Remember, when doses come in, the goal is not to administer all the doses there. So you administer a certain the first doses to the population, and then again, as the protocol indicate, you have to, those who have received their first dose, you need to come back after 4 weeks to 6 weeks. So, I mean, it's not all vaccines that you receive that you try to administer all. So the fraction of those, you have to reserve vaccines for those who will be coming in to get their second dose. So that's why you always see this imbalance between the total vaccines and the uptake vaccines.
So thank you very much. I'm just looking for more questions that are coming in from colleagues. And just have a look at our chat section. And while I'm doing that, while I'm checking, may I request, Sarah, you had a second question that you asked earlier on. Please just write it on this chat section so that colleagues in the office can take note of it and enable Dr. John to respond to you next week. All right, we don't have questions coming in now, so I'm going to ask you one of my own. But before that, let me remind colleagues of that WhatsApp number, which is +251 94 550 2310. Alternatively, you can come live or utilize the question and answer section. All right, so Dr. John, you've spoken in the past about a new public health order. And one of the experiences that Africa has had in the last few weeks since the discovery of the Omicron variant has been a lack of enthusiasm on the part of the rest of the world to quickly accept the advice that was coming through from Africa. In the new public health order, how do you see that working out for Africa to position itself as a credible source of information and for the rest of the world to really start taking advice that is coming through from Africa more seriously than they did with the Omicron?
When the quality of the sound has deteriorated a lot. So I heard the first part, which is the new public health order, and then we also heard the second part, which talked about the recommendations from Africa CDC. But the quality, I didn't capture the last line. If you can repeat that.
All right, let me move closer. I hope that the sound is much better now. The question was really about the new public health order and the reluctance that we saw in terms of the rest of the world accepting the data and the information that was coming from Africa. There was a little bit of skepticism that we witnessed. And a slow uptake of the advice coming from Africa. How is the new public health order going to ensure that all scientific data coming from Africa is taken more seriously going forward?
No, I think it's a very fair question. I mean, the new public health order that we are promoting, and not just promoting, but we are riding on that. By the way, as part of that new public health order, it requires that Africa embarks on its own vaccine manufacturing, diagnostic manufacturing, and pharmaceutical manufacturing. Yesterday was a very historic day for me when the President Cyril Ramaphosa was at the inauguration ceremony with Dr. Patrick Songshun, who has established a facility in South Africa, Cape Town, to facilitate manufacturing of those three commodities and more, including about technology research. I think we should really applaud that effort. Someone was saying the other day that our target of achieving vaccine security by 2040 may actually be achieved sooner than later, given all what we are seeing, the movement in the areas of vaccine production in Africa, the Rwandas, the Kenyas, the Senegal, Nigeria, Ghana's that are all Morocco, Egypt. So I think I'm very encouraged with that. I needed to highlight that day for the continent to see such an investment. and also to see the continuous leadership of President Cyril Ramaphosa in guiding us. The second thing, of course, has been the need to strengthen our own institutions and give it a voice. So that comes with everything, including policy and guidance to the continent and the world. And it's not just Africa's CDC, but the WHO as well. I think we have to have a collective approach in the way that we deal with variants when they emerge, because new variants will continue to emerge. There's no doubt about that. We've seen the Alpha, the Beta, the Delta, the Omicron. So it clearly suggests to us that the viruses are viruses. They will always mutate, especially if offered the opportunity. So I guess that the information that the top scientists in Africa are generating should be shared, continuously be shared in a timely fashion. We continue to play the role of a public health agency, which means we put out the best advice informed by science. And there's not much you can do with that. I think as long as you ground the decisions or the advisory that you provided based on science, you can only continue to do that. That by itself is already part of the new public health order, where you're giving specific a context to a situation that is happening on the continent using an African platform, which is a public health agency for the African Union, a union that is made of 55 member states. That is very powerful, and that should be continuously be encouraged.
Thank you very much. We have a question that has come in from Blanco from the International Spanish News Agency. And Lucia says, we have seen important steps towards vaccine manufacturing. Apart from the new facilities, what tools are necessary to provide the continent with the capacity to produce its own vaccines?
Well, we need. I really apologize for the quality of the sound today. It's been really disturbing. So we need at least three things. One is the technology transfer, and then of course tied to that the technology that will be required for the active ingredients that are required and needed for vaccine manufacturing to be available. And then thirdly, you need a market that it's a demand and supply issue. You need a market that is reshaped such that when you produce the vaccines, you also have a market for the vaccine acquisition. So for the vaccine uptake. So that's what we have to do collectively, not just as Africa, but the world needs to step back and look at our collective health security architecture and see how you can balance those so that we guarantee not just the vaccine security, but diagnostics and pharmaceutical. I think that is the only way collectivity and prepare for the next.
Ibrahim Presba from iAfrica TV in Gambia says, Dr. John, going by the low vaccination rate in Africa, has the idea of Africa-made vaccines being the preference on the continent, he's asking, has this idea been discussed at all?
No, that has not been discussed at all. I don't think, and I might be wrong here, that the low uptake of vaccines clearly is related to a predictable supply of vaccines. If you recall, in April of last year, when the continent started receiving, it was an upbeat. Head of states after head of states were out there pulling out their arms and getting vaccinated. Then suddenly there was an abrupt stop of the vaccine supply on the continent. That created a lot of hesitancy and frustration, and especially for people that have received the vaccine. So if we had a steady supply of vaccines from the beginning of 2021, there would have been a massive campaign, a coordinated campaign that would have lifted up the nation. So I don't think it has to do with made in Africa vaccines. It has to do with uptake of vaccines in general. When you are muted.
Yes, thank you very much for that. I'm seeing another hand popping up from Sarah Jerving. Is that another question, Sarah?
It is, yes. Sorry, I'm having so many today. Which countries have expired doses and what efforts are being taken to change this in these countries? Thank you.
Yeah, I think it's what we have seen. I've seen in the media earlier, and the 2.8 million. I will need to break it down some. I wasn't given that information, but we've seen in the media the 1 million doses in Nigeria. And again, Nigeria has been very clear with that. These are vaccines that came in on short notice, and they have been very clear that they will not receive any vaccines that have short shelf life. So I can only go with what I've read on the media for the 1 million doses of vaccines from Nigeria. But a detailed analysis can definitely be made on the 2.8 million doses country by country.
Thank you very much for that. I think that's the questions that we have for today. I'm not seeing any hands going up, and I'm not seeing any questions on any of our other platforms. So, Dr. John, let me give you the chance now to give us your summary of the main points as takeaways from today.
Thank you, Gwen. I just have one point, which is a plea that we should make every effort to avoid vaccine wastage and vaccine that include expiring of vaccines. When I see that vial, I was in South Africa in May last year and went to the Aspen Pharmaceutical, took a vial of the Johnson & Johnson vaccine, and when I heard that vial in my hand, what was running through my mind was that this is a life that can be saved. Okay, it was very emotional to pick that vial and hold it there for about two minutes and just reflected on what that vial can do to a human life. So when I look at that and you extrapolate it to the thousands of vaccines that are expiring, I mean, it pains because that is potentially a life that can be saved. And the pandemic, as we all know, has killed about 5.5 million people across the world. And any expired vaccine is the vaccine that potentially could have saved a life, a loved one in a community, in a family, and in a country. So I think let's join forces and actually launch a campaign that says that no expired vaccines. I think maybe we'll do hashtag no expired vaccines or no wastage of vaccines, whatever. But we really need to join forces to work in that interface so that we do not actually normalize and begin to say that 1% of vaccine that are wasted or not expired is appropriate. No, we need to aim at 0% vaccine expiration on the continent so that every vaccine that arrives at the airport goes into the arm. Thank you very much.
Thank you very much. That was Dr. John Kengasong, the director of the Africa CDC. I can see that hashtag no expired vaccines are catching on very well. So thank you for that suggestion. Colleagues, that brings us to the end of our press briefing for today. We've been with you since 12 o'clock, and we will be here again at exactly the same time next week, giving you more information and updates on the COVID-19 situation on the continent. As usual, thank you very much to Dr. John Kengasong, the director of the Africa CDC, to yourselves, colleagues, for your continuous interest in this issue and the coverage that you give to this very, very important issue on our continent. Thank you to colleagues from the African Union and from the Africa CDC. Let us meet again next week on Thursday at the same time. Bye-bye.
Bye-bye.